Okay, so coming to chemotherapy, and I think you touched on that, Dr. Tawagi, a little bit, especially in the combination therapy setting. We see docetaxel. Again, docetaxel is commonly known as taxotere, and it is important to note that this is not a long-term chemotherapy. It is a short-term chemotherapy, meaning you do it for 6 cycles and then you stop. And that is something to be aware of, especially in the setting of prostate cancer, as these medications do have a role in improving survival in prostate cancer. That has been studied. So, some of the most common side effects that you see is neuropathy. That is sort of the nerve damage that these medications can cause. Skin rashes, hair loss, low blood counts. These are some of the things that we keep in mind while seeing these patients. And, these medications have a propensity of causing these side effects. But, Dr. Tawaji, do you have any other pearls of wisdom that you want to share with our patients?
Yes. So in the new stage 4 setting that's still hormone sensitive, again, for patients with very high volume of disease or high risk disease, we consider giving this for 6 cycles. Patients, depending on where, what institution you're getting chemo, may require a chemo port, a little device in the chest to get the chemo. Some centers may give it through an IV in the arm. And, I think it's really important for patients to be aware of the risk for lowering of the immune system and risk for infection, and need to present to the emergency room if there is a fever while they're on chemotherapy. And we monitor for all of these side effects over time. It's also given with prednisone, the steroid. So patients do need to take prednisone while they're on chemo twice a day. And in the hormone resistant setting, sometimes it's given even for more than 6 cycles, as long as patients aren't having too many side effects. It is continued in some cases for even longer, but given every 3 weeks, and as listed, it's about 1 to 2 hours for patients.
Yeah. And the next cousin that we have in this setting is cabazitaxel. Again, another chemotherapy that we typically use once the patients have gone through docetaxel that we just discussed, and also they have progressed through one of the novel hormonal agents that we talked about, that's enzalutamide, that's Xtandi or Zytiga, the abiraterone. And we'll talk about how radiopharmaceuticals have sort of changed the landscape in this setting. Although, this is still a very potent drug that is being used in the second line for these patients, and especially places where we do not have availability of radiopharmaceuticals, as we will discuss in the coming slides. This is a potent option that is still used for our patients who have metastatic castration-resistant prostate cancer. Again, I want to stress that it's in the castration-resistant setting. It's not in the castration-sensitive setting. Again, there are 2 dosage available. One is for patients who have good performance status, and there was a study done where there was a lower dose that was studied for patients who had poor performance status, and the drug did show that it can work in that setting as well. So there are some dose adjustments that can be done in cabazitaxel as well. And Dr. Tawaji and Dr. Kurian, anything else that you talk to your patients about while going through talking about cabazitaxel?
Yeah, I would say, a couple of things I tell people about, this medication. Definitely, if you've been through the docetaxel chemotherapy, and one of the key side effects we talk about with that is peripheral neuropathy or something, that causes permanent nerve damage sometimes as well. So that's something that we definitely take into consideration, because this medication, the Jevana or cabazitaxel, can cause neuropathy, even though it's to a lesser degree. There still is a risk of potentially making that worse. So that's something I definitely talk to patients about. And if we need to make adjustments in terms of the dose of the medication, some things we sometimes do as well. In addition to that as well, I would say that, for some patients that have very high volume disease, sometimes I do sometimes combine this with another chemotherapy called carboplatin. Sometimes in situations where patients may have a very high burden of disease, maybe in the liver or other areas as well. And say we're maybe waiting to get to that radiopharmaceutical, that Pluvicto medication that we'll talk about here, to try to bridge people to the next, treatment option. So this is something that I sometimes utilize in that setting. But definitely the same side effects for docetaxel in terms of chemotherapy side effects still apply to this treatment. And so, definitely, like Dr. Tawagi said, risk of infection, bleeding, fatigue, hair loss, things like that, all still stand. So it's something that, as one person goes from one chemotherapy to another, we have to assess and make sure that, the person is able to tolerate, the medication. Otherwise, okay, we may need to start considering other potential options.